Located in the heart of Columbus, Ohio at COSI, the Center of Science and Industry, children are learning about prescription medications and how they can help or hurt them at the new Generation RX lab.
Every 19 minutes, someone is dying from an intentional overdose of prescription drugs. The intent of these space is to help bring research that's going on at Ohio State to the public eye. For us, that means drug education research. How can we teach about how drugs are working and then how to use them correctly? And that's the gist of Generation RX.
Resources are critical in the ongoing public awareness campaign. Knowing this, the Cardinal Health Foundation stepped up to partner in the larger Generation RX initiative, and the lab at COSI is the latest edition of the partnership.
We recognized that there was a growing problem of prescription drug misuse and abuse. We also understand that that has tremendous implications for our country and that the problem is a growing epidemic. So we looked at it as both an opportunity as well as a responsibility to really help drive education, awareness, and ultimately prevention. So we were looking to partner.
The Generation RX collaboration that we have with Cardinal Health really allows us to interact with community partners, with school groups, with parents organizations, with church organizations, to expand that knowledge about the problem of prescription drug abuse.
The reaction to the new lab has been tremendous.
And what we do here are experiments related to how medicine works in our bodies.
Dr. Molly Brown is assistant director of the lab, and she works directly with visitors.
You guys see the tube with the green poopy stuff?
From a child perspective, the fact that they get to put on real lab coats, gloves and goggles, they have that experience of, I feel like a scientist.
Germs, that's right. So
Because our experiments relate to how medicine works in the bodies, we try to demonstrate safe medication taking practices or talk about how science can bust some of the misconceptions and myths surrounding prescription drug abuse.
you want it to be mixed up really, really well.
Pharmacy students also gain from their participation in the latest Generation RX initiative.
Shake it up real good.
When I first entered my major in pharmaceutical sciences, I thought I would just end up in a retail setting. In my future, I realized that it's very important for me to continue spreading this message of medication safety, whether I am in a retail setting or here in a lab like COSI.
Sometimes not only the kids come away learning new things, but also the parents as well, and they'll stay around and ask us about some of the things that we've been talking about because they're just as interested as the kids are.
It was probably one of my favorite rotations I've had so far. And I just think it's just an example of the different kinds of things that Ohio State can offer. All the things pharmacists can do. It's just so beyond even what I realized.